Dan Lewis. My name is Gail Tamarchio, and I'm the Friends Life Care Director of Wellness Initiatives, and I'll also be your moderator for today's webinar. We're going to get started in just a minute, but before we do, I just want to be sure that you have all the information that you need. You should have received an email at 10 o'clock this morning that had obviously the link to today's webinar and also a link to today's handouts. If you didn't see that link, they are also on your attendee interface. So here's an example of the attendee interface that will show you. Oh, Dan, would you switch the slide? Oh, Dan, I'm sorry. Click on the screen.
There you go.
Thank you. Okay, Dan's my technical assistant today. So, okay, thank you, Dan. So this is a screenshot that shows what you should be seeing on your computer right now. You are listening in by your computer audio by default. If for some reason you're having trouble hearing, the volume's too low, just check this, the setting on your speakers. If you would prefer to call in over the phone, just click on the phone call button and then you'll get the dial-in information and you can just call in and follow along with the webinar. Also, you'll have a chance to ask questions during the webinar today. Dan's going to stop at some point during the webinar to ask questions. And we just ask that you ask questions that are of interest to the general group. If you have specific questions to to which plan you should choose, Dan's going to give you some information at the end of the webinar about how you can contact an APPRISE counselor and you can get some one-on-one counseling yourself to answer your individual questions. So, but he will definitely answer all questions that are pertinent to the general group. So now I'd like to introduce our speaker. So Dan is very importantly a Friends Life Care member, and we're very happy to have him here today. And he's also a volunteer counselor for APPRISE, which is Pennsylvania's state health insurance assistance program, which provides free, unbiased Medicare advice. Previously, Dan was Research Associate Professor of Family and Community Medicine and the Managing Director of the Center for Research in Medical Education and Healthcare at Thomas Jefferson University. So you have all kind of healthcare background, and we appreciate you taking the time to learn about this yourself and to share your information with us, Dan. Thank you for being here today.
Thank you, Gail. Can you hear me okay, Gail?
Mm-hmm.
All right.
Certainly can.
How do I, oh, there we go. Medicare, believe it or not, is now 55 years old. They tried many, many times. This is a picture of President Johnson signing the Medicare law in 1965. With him is Harry Truman, his wife Lady Bird is behind him. Harry and Bess Truman are there. Why are they there? They're there because the Medicare law was a culmination of efforts going back to FDR, Harry Truman, JFK, all of whom failed to get it passed. In fact, some historians believe that if JFK wasn't assassinated, I'm old enough, and I assume some of you are old enough that I'll never forget that day in November 1963. But when LBJ became president, he was the ex-Senate Majority Leader and a consummate politician, and he managed to get Medicare and Medicaid, for that matter, signed into law. So it's got a long history. As Gail said, some of you may have already received this Medicare and You book for 2021. Hopefully you all have your new Medicare cards. And I am a volunteer APPRISE counselor. And why did I do that? I mean, I did it because even though part of my job at Jefferson was teaching the medical students about health insurance, I became an APPRISE counselor because when I got ready to sign up for Medicare several years ago, I thought this is going to be easy. I know what I'm doing. But the reality is that I didn't. I had a lot of questions, and I ended up getting help from APPRISE, which is why I volunteered to become an APPRISE counselor. So thanks for coming this morning, and I'm going to give you some, hopefully give you an overview of Medicare. As you know, the Medicare Annual Open Enrollment Period starts October 15th through December 7th. So this is a very, very timely webinar. So what are we going to talk about? Quickly, what is Medicare? who's eligible, when and how to enroll. I assume many of you are already on it, so we're not going to dwell on that. We'll talk about what Medicare pays for, and as importantly, what it doesn't pay for. We'll talk about how much it costs and some insurance programs that can help supplement your Medicare coverage. And we'll talk about the choices that you have to make, whether you're new for Medicare or if you're already on Medicare. So finally, we'll talk a little bit about how you can get help from APPRISE if you, have further questions after today's webinar. So Medicare, as most of you know, includes Part A, which people think of as hospital insurance, but it also includes the other things I've shown you on the list. I'm not going to read these to you. Part B of Medicare, people think of as medical insurance, which pays doctors, which is true, but also covers the other things that you can see on this list, such as home health care, durable medical equipment, preventive services, etc. And then a newer benefit is the Part D prescription drug coverage. You'll notice that I skipped Part C. For some reason, I guess just to confuse all of us, they call the Medicare Advantage plans Part C. So we'll talk about those later. Relatively quickly, because I assume most of you are already on Medicare, but typically, you qualify for Medicare when you turn 65 years of age. There are residency or citizenship requirements in addition to your age. You can also qualify for Medicare if you're under 65, if you have been determined by the Social Security Administration to be permanently disabled. And then after that, you have to wait 24 months. Or without the waiting period, if you have end-stage renal disease or Lou Gehrig's disease, ALS. Now, why people say, and I agree, why the 24-month waiting period? It's not easy to get determined to be totally disabled or permanently disabled. I'm sorry, not totally, permanently. And of course, the reason is very simple. It's money. They felt like it would be too expensive. So how do you sign up? You get it automatically if you're collecting Social Security on the day of your birthday. You'll get it automatically after you've waited the 24 months. And if you're 65 but not getting Social Security, you just contact the Social Security Administration. We used to say you could go into the office. With COVID, you can't, but you can do it online or over the telephone. You cannot go there in person these days. And you have, and part of the reason that I have to do these seminars, webinars now, is because of the incredible amount of jargon with Medicare. I don't know if it's a bureaucratic disease, but the first piece of jargon is something called the initial enrollment period. And that's the 7-month period, which includes the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. And this is when you should sign up for Medicare, assuming you don't get it automatically. We strongly recommend that you do it in the 3 months before, because that's the only way that it will actually start on the first day of your birth month of your 65th birthday. So easy to do, just plan a little bit in advance. Many of us, including me, are still working when we turn 65. And you don't have to sign up for Part B. Part A is fine. That you don't. Some people say you get it for free. It's definitely not free. That's what you've been paying for through your whole working career, paying into the Medicare Trust Fund. So it's not free, but there's no monthly premium. So if you don't enroll in Part B, because you have the most common reason is you have a group health plan through your employer or your spouse's employer. You then have, let's continue the jargon, a special enrollment period, which is the 8-month period which begins when your employment-based health coverage or your spouse's health coverage ends, and now you can sign up for Medicare. A caution, COBRA, which some people choose, is not considered by Medicare to be employment-based coverage. Market-based plans through the Affordable Care Act, Obamacare, are not considered coverage through your current employment. So you're not eligible for this special enrollment period. Some people make the opposite mistake. They rather than deferring their enrollment in Part B, they say, oh, what the hell, I'll just start paying the Part B premiums. And of course, one problem is you're paying a premium when you don't really need to. The second problem, and we'll talk about this later, is the clock starts ticking as soon as you sign up for Part B on something called the 6-month Medigap Open Enrollment Period. And we will talk about that later on in this session. Now, if you miss all of these, if you miss the initial enrollment period and the special enrollment period, it's not that you're out of luck for the rest of your life, but if you didn't sign up during one of these periods, you can sign up between January 1 and March 31st of each year. Your coverage won't begin until July of that year, and you will pay a penalty, and you'll pay that penalty, that late enrollment penalty, for the rest of the time that you're enrolled in Medicare. So it can be very important penalty, as you can see, 10% for each 12-month period with which you delayed. Okay, so that's signing up. I think most of you are already on it, so I think enough on that. Now, in case you guys haven't noticed, healthcare, medical care is expensive, and Medicare helps, but it doesn't pay for everything. So Medicare doesn't pay, for example, for premiums. That's a monthly premium that you typically pay for various things, and we'll talk about what premiums are. There are deductibles in Medicare. There are co-payments, which are typically specified as a dollar amount, or coinsurance, which is specified as a percent. And then, of course, Medicare doesn't pay anything for those services that are not included in Medicare. So let me go through some of these expenses to give you a sense of how high they can be. Let's start with Part A. Remember Part A, the hospital insurance. So you don't pay a premium for Part A typically, but there are deductibles for in 2020. By the way, I apologize, but I checked as of yesterday afternoon. The Part A and Part B deductibles, coinsurance, premiums are not available for 2021. This is typical. They come out later in the year. They'll change a little bit, but not substantially in 2021. So these slides at least are the 2020 numbers, and the 2021 numbers will be out before the end of the year. Some people are speculating, but since the official numbers are not out, I didn't want to put them in. So in 2020, you pay a $1,400 deductible for each benefit period. And you can have more than one benefit period in a year. So you could end up paying more from that. You don't pay a coinsurance for the first 60 days, but then you pay another coinsurance. Obviously, this can add up to a substantial amount of money. That's Part A. Part B also has a deductible. That's $198 in 2020. It would probably go up a little bit. and you pay coinsurance. Now, most of you are familiar with this. So coinsurance is 20% of the Medicare allowed amount. So for example, if I go to my doctor, a PCP or a specialist, and the doctor sends a bill for, I'm making up these numbers, obviously, for $200. Medicare says, oh, Doc, I don't care what you're billing. The Medicare allowed amount is $100. Medicare then pays 80% of that, and I'm responsible for the other 20%. Either I can pay that out of my pocket, or I can buy some other insurance that helps to cover that. So that's the co-insurance for Part B. And then, because there is no trust fund for Part B like there is for Part A, there's also a monthly premium. And the monthly premium for Part B is a minimum in 2020 of $144.60 a month. But Part B has something called an IRMA, Income Related Medicare Adjustment Amount. Again, more jargon, just for the fun of it. And you can see from the table that your Medicare monthly premium can be fairly substantial depending upon your income for Part B. You can see the big differences. Now, one big caution: they base your 2020 premium on the tax return, something called the modified adjusted gross income from 2 years previous in 2018. And many people enroll in Part B because they're retiring and no longer have employment-based coverage, and their income may go down. They recognize this, and there is a very easy way to appeal. And it's absolutely worth it. It's easy to do. I did it online because I was in that typical situation where my income went down when I retired, and but they didn't know that from my tax return 2 years previously. If anybody wants to know, there's a specific form I can get that information to you, fill it out, and within a couple of weeks I got an approval. They do check, so lying doesn't work. Finally, we can talk about Part D. And Part D also has an IRMA. Excuse me, let me go back to the previous slide. Part D has the premium for Part D is primarily based on the plan that you pick. There's no basic premium charged by Medicare as there is for Part B, but Part D also has an IRMA amount, and I'm not going to dwell on it. You can see the Part D premiums for 2020 depending upon your income. As I mentioned earlier, this will all change for 2021, but not substantially. The brackets will change, and the amounts will change probably by just a couple of dollars. There's also a late enrollment penalty for Part D. So some people that I'm counseling say, gee, I don't take any drugs, or I take just really inexpensive drugs. Why should I sign up for Part D? Well, the answer is, if you don't sign up for Part D, and then you try and sign up 3, 4, 5, 10 years later, when you're taking some expensive drugs or potentially more expensive drugs, you will pay a premium, pay a penalty, and you'll pay that for the rest of your life. So it's important to sign up. There are Part D plans that are relatively inexpensive, less than $15 a month. So it's definitely worth signing up for Part D, even if you don't think you need it, as soon as you're eligible for Medicare. So you can avoid the penalty if you have, let's continue with the great jargon, creditable coverage. And what does creditable coverage means? It means it's drug coverage that's as good or better than what Medicare offers in Part D. So you don't have a penalty if you have a Part D special enrollment period because of drug coverage through your employer, and the employer will provide proof of that. And then, you know, you can be eligible for the special enrollment period. An aside too, some people have drug coverage, I'll talk a little bit more about this later. If you have Veterans Administration drug coverage, you don't have to sign up for Part D if you get your drugs for the Veterans Administration, because the VA coverage is considered creditable coverage. So if you change your mind at some point later on, you would not pay a penalty and you could sign up for Part D. Okay. So, you know, obviously there are a fair amount of costs, and the question is, how can I get help paying for what Medicare does not pay for? And, you know, to answer that question, I'm going to turn to that very famous philosopher who said, when you come to a fork in a road, take it. Or, as he also said, if you don't know where you're going, you might not get there. Yogi Berra, obviously. And so let me try and give you an idea of your choices that you can make. And there are two paths. This is maybe the most important choice that you make in the time that you're on Medicare, is choosing one of these two paths. So this is what we're going to focus on for the rest of the time. You can stay with so-called original Medicare, which includes the Part A hospital insurance and the Part B medical insurance, and then add a Part D drug plan and a Medigap supplemental insurance plan. And we'll talk about that, what that means. Or you can choose what they call Part C, a Medicare Advantage plan, which usually combines Part A, Part B, and usually a Part D prescription drug plan, although there are some that you can get without prescription drugs to accommodate those people who don't need a drug plan. And one thing, just to be perfectly clear, is you cannot do both. You cannot have a Medigap plan and a Medicare Advantage plan at the same time. You can't be sold or use a Medigap policy if somebody fraudulently sells you one or mistakenly sells you one to so-called supplement your Medicare Advantage plan. You cannot do that. So, Gail, I don't know if there are questions so far that we should pause for. I'll be happy to.
We just have one question, and it was just a clarification question. So somebody asked, if you sign up for Part A during the initial enrollment period, and then when you retire, you sign up for during the special enrollment period, would that help you avoid the penalty? You're still working when you sign up for Part A, but then you get Part B once you retire. You don't have a penalty as long as you sign up during the initial Part A.
That interpretation, I believe, if I understand, is correct. In the sense, you get Part A when you're 65, even if you're still working, you know, right. You get Part A, but no problem, because you've already paid into that. There's no premium. There's no reason not to get it. And then when you stop working and you no longer have employment-based coverage, you would qualify for that 8-month special enrollment period. So there would be no penalty for you to sign up. Now, again, we strongly recommend doing it in advance, because if you want the coverage to start right when your employment-based coverage ends, if you do it in advance, we can help you get it set up so that there's no gap in your coverage. But you do have 8 months without a penalty.
Okay, thank you. And then there is one more question. Are there any drawbacks to the Advantage plans?
We're going to talk, that's the next,
okay.
step. We're getting right there, of course.
Set you up for your next part, right? Okay,
It's
good.
perfect segue to the next part of the presentation. So thank whoever asked that question. Thank you very much. It must be the person I planted to, help me with this presentation. So how do I choose? What are the pros and cons of a Medigap plan versus a Medicare Advantage plan? And I have to say that there is no one answer that's right for everybody. We're very careful when we're counseling. We're providing information. You have to decide what's best for you. And that depends on a whole variety of individual circumstances, including your ability to pay premiums, your desire to travel, what kinds of doctors you use, et cetera, et cetera. So what we're going to talk about right now is the pros and cons. How do you choose a Medigap plan? And how do you choose a Medicare Advantage plan? But first, let's start with the comparison between the two. So I put here, and I apologize, these are going to be sort of busy slides, but I wanted you to have this information. There's no way of avoiding having Part A and Part B. So whether you're in Medicare Advantage in the column on the left or original Medicare plus a Medigap, you have to have Part A and Part B, and you'll have to pay the Part B premium. Medicare Advantage plans are typically HMOs or PPOs, and that means that they typically have networks of doctors and hospitals. Medigap plans are not HMOs or PPOs. If you choose a Medigap plan, you can go to any physician or hospital in the country that accepts Medicare. If you're in a Medicare Advantage plan, you have to follow the rules of the plan. It's more like the insurance that you and that I and many of you probably had when you were working. There are plan rules. They may require referrals. They may not. Medigap plans don't make decisions about what to cover. Remember that example I gave? You go to the doctor, $200 bill, Medicare pays 80%, and then the Medigap plan just picks up the difference. And if Medicare approves it, the Medigap plan will pay the part that they are required to pay. Simple as that. The Medicare Advantage plan typically have co-pays or co-insurance, and we have one of the things you can find this online, or we have summaries of it. Co-pays for PCP visits that may be as low as $0, it could be higher. Co-insurance for PCP specialist visits, special outpatient hospital, etc. But Medigap basically just pays their specified share of the medical bills that Medicare doesn't pay. Medicare Advantage plans do have some maximum out-of-pocket amount each year, so that you would not go over. In 2021, the maximum I saw, if you stayed in network, and this is the 2021 data, is $7,550, at least in the Philadelphia plans. Okay, let's keep going. Most Medicare Advantage plans include prescription drugs. If you choose to go with original Medicare plus a Medigap, you'd have to buy another separate prescription drug plan. The Medicare Advantage plans and the original are very easy to navigate. And I'll show you something later on in the presentation about buying a Medicare Advantage plan through the so-called Medicare Plan Finder on Medicare.gov. Medigap plans, there's hardly any information about Medigap plans because they're state regulated. So you can't buy them through Medicare.gov. In fact, you can't even get the information about them that you want. But you can get it directly from an insurance company, or a broker can help you, or we can help. we have access to a search tool that the state pays for. It's the same tool that the brokers use. So I can get prices of all the Medigap plans, and I'll show you an example of how that works. The Medicare Advantage plans are starting to offer a number of additional benefits: vision coverage, dental, hearing, fitness, travel emergency, that aren't part of traditional Medicare. Medicare, you really have to be cautious. Some of the plans have restrictions on their use. Some aren't as good as they sound. Some are terrific. So, I think they're trying to offer this to promote their plans, and I don't see that as a bad thing. But if you're interested in a Medicare Advantage plan, because you want to get a silver sneakers membership in a fitness center, do due diligence and see whether it's really worth it. Medigap plans don't offer as much. Some are now offering fitness, and some offer travel emergency coverage. With Medicare Advantage, the plan you choose, you can change it every year. Every year, October 15th to December 7th, you can take a look at it, decide you don't like it, switch to another one. So if you're in the blue plan this year and you want to switch to the green plan next year, between October 15th and December 7th, you have a Medicare Open Enrollment Period. Medigap is different. And I'm going to emphasize this multiple times. You only have what's called guaranteed issue for Medigap in, again, let's add to the jargon, the 6-month Medigap Open Enrollment Period, which is not the Medicare Open Enrollment Period, which is the 6 months after you sign up for Medicare Part B. So during that 6-month period, they can't ask you any questions about your health. It's not a matter of even that they can't use it, they can't even ask you, and you can get into a Medigap plan. After that 6-month Medigap Open Enrollment Period, you may not be able to get in, or they can use medical underwriting and deny coverage. Terms of premiums. If you're looking for very low monthly premiums, some Medicare Advantage plans actually have 0 monthly premiums. There are quite a few. The monthly premiums for Medigap plans are typically higher. In both cases, spouses are separate. There's no spousal health insurance like there is through your employer. So if you're in a Medicare Advantage, you and your spouse would have to buy separate plans. You don't need to buy the same one. In Medigap, some of the companies offer 5, 7, 10% so-called household discount if you and your spouse both sign up for the same plan. So this slide is the same as the previous slides. I just put it in there so that you'd have all of that on one page. So let's start with Medigap. Actually, Gail, are there any other questions before I go on?
Yes, there are. Hold on one second. So somebody wants to know, how can the insurance companies afford to offer so aggressively low premiums for their Advantage plans, which sometimes even include vision and dental coverage? Do they get paid on the back end? Not unlike a car dealership, which can sell you a car for, say, $100 above the dealer invoice.
Well, that's of course an incredibly complicated question, but there are a number of reasons. And actually, the premiums for Medicare Advantage plans have gone down this year on average. And why is that? A number of reasons. One is COVID. Even though COVID is expensive, a lot of people have deferred care. So the insurance companies have made a lot of money over the last year. The hospitals and doctors have lost a lot of money, but the insurance companies have made a lot of money. So that's one reason.
Mm-hmm.
Another reason is Medicare Advantage charges premiums and copays. So they may look very low in terms of their monthly premiums, but if you end up in the hospital, or if you end up having to go in for, infusions once a month, you may end up spending a lot of money, not based on the premium, on something else. The other answer is, this goes back to my research at Jefferson. Medicare Advantage plans are paid by the government based on a risk-adjusted capitation. So they receive more money for sicker patients, and so they're not taking as much risk as it might seem because of their reimbursement that they're paid by Medicare, because they're assuming all the risk now. They're taking over everything, Part A, Part B, and typically the drug plan, but their payment isn't the same for everybody. And the logic behind it is they want to incentivize the plans to not deny or make it difficult for people with health problems to join the plans. So, the old joke it was that insurance companies will take all comers, but our office is on the 5th floor and there's no elevator. So if you can walk up there, well, you can sign up for our insurance plan. So the Medicare Advantage plans are trying, or the government in setting up the Medicare Advantage plans is trying to avoid that. So they're trying to say, if you enroll people with diabetes mellitus or hypertension or CHF or COPD, we're going to give you more money to pay for that. So I hope that it's a very good question and a complicated answer. I apologize, but there is no simple answer to that.
What a surprise, right? Okay, so one other question. Somebody asked about, I guess she's on her deceased husband's retirement plan, and she was wondering if would the retirement plan pay her Medicare and Medicare Advantage premiums? That wouldn't come out of a retirement plan, would it?
That person should call APPRISE because that's complicated.
Okay, gotcha.
It's a complicated personal question, but yeah, we would have to look into that in more detail.
Okay, I didn't know if that was a general type thing. Okay, thank you. That's what we have right now.
All right, good. So let's start with talking about Medigap. So there's the two paths, and that choice of paths is really, really important because, as I said, it is possible to switch Medigap plans if you're healthy. I switched from one company to another, not for any particular reason other than a company that I do business with my homeowners and other insurance didn't offer it in my zip code, and then they started offering it, and I thought, well, this will be nice. It was the same price, so I switched, but I had to go through medical underwriting. But you have to. This is very important. If you're going to sign up for Medigap, it may be a choice for life. So when I was signing up for Medicare, I spent 95% of my time thinking about what Medigap plan I wanted to choose, whereas the drug plan was not a big deal because if I didn't like it or my prescriptions changed, I can change that every year. So this is really important if you're signing up for Medigap. There are health insurance policies that are standardized. They work with original Medicare. They're sold by private insurance companies. If you have a Medigap plan, it pays part of the remaining cost. Medigap plans only work with original Medicare. You can't buy a Medigap plan if you have a Medicare Advantage plan. I said it, but it's very important, so I want to repeat it. Just to make things simple, Medigap plans are standardized and they're identified by letters. And by the way, I want to make it clear, this is if you're talking to friends or relatives that live in different states, this is everything that I'm talking about here is for Pennsylvania. So if you live in another state, you really should check with that state, because the state's insurance departments have different rules. But in any event, this chart, and they're identified by letters, is Medigap Plan A, B, C, D, F, G, K, etc. I highlighted in yellow on the right. They've eliminated the C plans and the F plans. If you're newly eligible for Medicare after January 1st of this year, you cannot buy a C plan or an F plan. If you have a C plan or an F plan, you can keep them. And actually, the thing that's a little confusing is if you're trying to switch into a Medigap plan, but you were eligible for Medicare before January 1st, 2020, you actually can still buy a C or an F plan. But in any event, you can see from the chart describes what the coverage is. So the most generous plan right now is a G plan. And let's look down the column here. This means, remember that co-insurance each benefit period for if you end up in the, I apologize, if you end up in the hospital, that's paid 100%. The Part B co-insurance is paid 100%. So that 20% that I talked about co-insurance, it's picked up by my Medigap plan. Blood, hospice care, skilled nursing facility, the Part A deductible. The Part B deductible, that's the only difference between the G plan and the old F plan, is that you're responsible for the Part B deductible, which in 2020 was $198. Not clear exactly what it'll be in 2021, maybe a little bit higher. So Medigap plans, a G plan, which is what I have, really pick up pretty much everything. I had surgery on my shoulder last year, and the bills so far, including the hospital, the surgeon, the anesthesiologist, the x-rays, the MRI, were over $75,000. The bills, fantasy, made up by the hospital. And I say that even though that's Jefferson is where I work. Medicare paid about $5,000. My Medigap policy paid another $1,500, and I was not responsible for anything. My total out-of-pocket expense for that $75,000 bill was $32, and that was for the prophylactic antibiotic I got and the oxycodone for the pain after my outpatient surgery. So you can see how Medigap works. Now, buying a Medigap plan. I mean, basically, typically, the more extensive the coverage from that chart, the higher the monthly premium. But one thing that I don't know how to say this more strongly, a G plan is a G plan is a G plan. There's no difference in the coverage by law between a G plan from one company and a G plan from another company. And anybody tells you different is not telling you the truth. It's not just G. An N plan is an N plan is an N plan, regardless of the insurance company that you sold it. So you have to decide what you want. There's another consideration. The plans are allowed to use different approaches to pricing. There are 3 different approaches. Most of them used something called attained age rating, which means that you pay a premium one year, and as you go up, your premium is going to go up. In addition, they can go up when the costs of the plan go up. The only exception is United Healthcare, which offers something called community rating. Now, that doesn't mean that they can't raise the premiums, but they can't raise them just because you're getting older. And one of the big dilemmas, because United Healthcare, AARP United Healthcare, typically costs somewhat more initially, is, does it make sense to pay that up front? And that's an individual with the hope that you'll make up the difference in 5 years, 10 years, 15 years. That's something you'll have to decide. We can help you think about that, but you'll have to decide that later on. So you look at the premiums, you can look at the history of price increases, you can look at the type of organization. There are some organizations that sell Medigap plans that are, affiliated with religious organizations. And, I counseled a woman and her husband who I worked with for years, and there's a Lutheran Medigap plan, and they're Lutherans, and it's a good plan, and it's a G plan, there's a G plan, there's a G plan, the price was right, and I'm not Lutheran, so I wouldn't have signed up for it, but they did, and they're perfectly happy. So one thing I hope I told you, but very clearly, the Medicare Plan Finder has very limited information, but we can help, and I'm going to show you an example of how we can do that. This is the help that I needed when I signed up for Medicare, that I tried doing it on my own, and it was simply impossible to get this information by calling the individual plans. I thought, well, gee, I was a researcher, I can do it. Didn't work. They wouldn't give it to me. So we sign up for this, or the state pays the Department of Aging for us to have access to this market research tool. And basically the way it works is I can't give you this site because I'm not allowed to give out the site, but we can do a search for you and send you the results. So, we enter the zip code, we enter your age, we enter whether you're a tobacco user or not, we enter your gender, we enter the type of plan, a G plan, a C plan, an N plan, etc. And if you had a household discount because there are two of you, we can put that in, and we just run a quote. And I just printed out the first page of about over 30 different plans in the whatever zip code I put in. And these are the monthly rates. I can't remember whether it's whatever I put in, a man or a woman, whatever, 132.10, 133.85, etc. Now, you can get some information about this Erie Family Life Insurance. I don't know, I never heard of them, but they have a pretty good AM Best rating. Everybody's heard of Aetna, and it's only $2 more a month. That's up to you, and whether you want to spend that. And this is if you want more details, we can go into this. I just did this so-called market analytics for the Aetna plan, and the price is $134.36 a month. This is their forecast increase as you age over the next 4 years. You're 65 now through say age 69, so it's not a huge increase. And this market research didn't have their increase history. It does have their AM Best rating. It does have the number of lives and the premiums, and some more information. So we can provide this information for you, and then you can simply call the plan if you want and enroll, or get a broker to do it for you. You can't get a discount by not using a broker. The brokers get paid by the Medigap insurers. There's no way around that. I looked into it. So let me go back. There's this Medigap Open Enrollment Period that starts in the first month you're covered under Medicare Part B and you're 65 or older. It's one time only. You can buy any Medigap policy. And as I said, that's different, as I discovered. My mother lives in New York State. They have open enrollment continuous for Medigap. You can sign up for Medigap anytime you want. So this is state specific. During that period, you can't be denied. But if after that, they're going to do medical underwriting. You may be able to get it, but you might not be able to. So that's a very important consideration. And I want to emphasize Medigap Open Enrollment Period and the manual Medicare Open Enrollment Period, which starts in about a week, are not the same thing. The annual Medicare Open Enrollment Period, October 15th to December 7th, you should possibly change. You don't have to change, but you should review your coverage during that period. Gail, before I go into, we're doing really well with time. So if there are any questions about Medigap, let me try and answer those, and then I'm going to talk about the prescription drug plans and the Medicare Advantage plans.
Okay, so we don't really have a question, but somebody just wanted to clarify skilled nursing care. So to make sure that people understand that Medicare defines that as rehab care, not long-term skilled care in a nursing home facility.
Yeah, and skilled is skilled, and there are very big restrictions. You have to have been in the hospital for more than 3 days, and it's not, Medicare has no coverage for CCRC, long-term care, custodial care. It's skilled nursing care only after a hospital discharge. So that's correct, a correct comment.
Okay, thank you. Oh, so we do have a couple more things that came in. Somebody wants to know if there's any reason not to use a broker.
The answer is no. I guess not. I mean, there's no financial reason not to use a broker. They get they get paid by the insurers, and you can't save money. The question, of course, is how do you pick a good broker? And they're not all created equal. So we can give you the same information that a broker gives you, but some people come to us, we give them the information, and then they call a broker. It's up to you. Really not a problem.
Okay. And then somebody asked, when is the Medigap Open Enrollment Period?
The Medigap Open Enrollment Period is the 6 months after you sign up for Part B, after you're 65 years of age. So that's it. It's a one-time period.
One-time window.
One time, 6 months after you sign it, you're 65 or older and sign up for Part B. Now you have a 6 month, excuse me, an 8 month Medigap. Is it 8 months or 6 months? You have, I can't remember. Is it 6 months or? 6 months. It's a 6 month Medigap Open Enrollment Period after you sign up for Part B.
Thank you. And now someone says if they have a, can they change Medigap plans with the same company? So if you have a C, can you switch to a G? Or if you have a G, can you switch to a C? Can you switch back and forth?
The answer to that is maybe. They don't have to let you. I actually have experience with clients who've tried and were denied that switch. Some people don't like being in the F plans. I don't think they've been a good deal for a number of years. I don't think the extra premium for an F plan was worth the extra coverage. And now some people think that because they can no longer sell F plans, the costs are going to go up. So they've tried to change to like a G plan, which is almost the same, except for the annual Part B deductible. And I have clients who are husband and wife, and they let one of them switch and not the other, same company, because he had no health conditions and she did, so they wouldn't let her switch. So you have better chance with the same company. I would certainly give them you lose nothing by trying. If you want to switch to a different Medigap plan, you don't have to give up your coverage. You can apply for the new plan, call them, have a broker call them. You don't give up your old plan. You're not doing anything until you're approved for the new plan. So the only thing you're risking is a little bit of your time. So if you think you might be able to get a better deal, I encourage you to try and switch Medigap plan either within the company or to a different company. It's risk-free. The only thing you're risking is a little bit of your time, because you don't quit the old one until you've been approved for the new one.
Ah, thank you. And then can an insurance company offering the Medigap plans, can they leave the market as sometimes long-term care insurers have? And if so, what happens to the insured if this happens? Will they end up with more?
There are very specific protections if somebody goes bankrupt or leaves the market. So don't worry about that. We recommend joining a plan that looks solid, but that's not really a concern. If they stop offering plans, typically, if they're just not selling them in your zip code anymore, you'll still keep the coverage. Doesn't matter, because again, with Medigap, you can go to any doctor or hospital in the country. But if for some reason they go bankrupt or stop offering insurance, there is protection. So I wouldn't worry about that.
Oh, that's reassuring. Thank you. Okay, no, somebody has a question. They say their broker changes their B plan and drug plan every other year or so, and this saves him money, but does the broker make money each time he changes them?
We're going to talk about Part D plans, but I wouldn't worry about it. The brokers are almost doing the Part D plans as a favor to you. They're the commissions that they make on Part D are so small that it's really, they're almost doing it as a service to their clients. So if it saves you money, go for it. I wouldn't worry about that.
Okay, that sounds good. Thank you. Now, somebody just wants to clarify. They said, is a choice for Medigap and Medicare Advantage only possible once? I think you said for Medigap. Or can they change their mind after choosing one for a year?
You can always change your mind. Well, you can, after being in Medigap, you can switch back to Medicare Advantage. And there are some special opportunities the first time you're in a Medicare Advantage. But if you're in a Medicare Advantage plan for 2 or 3 years, you can switch Medicare Advantage plans, but you may not be able to get a Medigap plan. They can now do medical underwriting. So, some people decide if I'm not sure, maybe I'll start with a Medigap plan because I can always switch to Medicare Advantage later on. That's one strategy that some people have taken. When I say always, I mean every year that a Medicare annual open enrollment, you can switch to a Medicare Advantage plan. I think we better move on, Gail, to the and then we'll still have time at the end for more questions. Okay.
Right, that sounds good. Thanks.
Okay. So now we've talked about Medigap. Now I'm just going to give you some really quick examples, and I think this is really a very, very good tool, the so-called Medicare Plan Finder, which didn't work very well at the beginning, has been improved a lot. And any of you that are at least halfway computer savvy can do this yourselves, although we're happy to help, we being the APPRISE counselors. And you would use this Medicare Plan Finder to choose either a Part D prescription drug plan to add to your Medigap plan, or a Medicare Advantage plan that includes prescription coverage, although you can also get a Medicare Advantage plan without prescription coverage in those special situations that you can see in the footnote here that I talked about earlier, excuse me. So let's go through this. So I'm just going to give you an example. One very strong recommendation. Any of you who don't have it, set up an account. Get a My Medicare account. It's really simple to do. It's like setting up any account online. Pick a username. We strongly recommend that you use your email address as your username for 2 reasons. One, you won't forget it probably. And 2, it's unique by definition. Nobody has the same email address that you do. And the Medicare requires that you have a unique username. So if you use your email address, you're safe. once you try to create the account, it'll show you what the password rules. It'll give you all these questions about what you need to do if you forget your password. The secret questions about your best friend's mother's name when you were growing up, that kind of thing. So I'm strongly recommend set up an account if you don't have it. I have an account, of course, and I logged in. And once I logged in, it knows that you can see, it knows that it's me. I hid my password, so please don't give that away. Right now, it's telling me, it's warning me that even though I can see the 2021 plans, the drug plans and the Medicare Advantage plans are now available on the Plan Finder as of October 1st, but you can't actually enroll until October 15th. So I'm going to start. I checked this box that said drug plan. So that's what we're going to look at first. And it knows, one of the nice things about having a account is it knows the drugs that prescriptions I've filled using my Medicare Part D account in the past. So it actually, the first time I went in here, it had those drugs that I got post-operatively, but I didn't need them anymore. So I got rid of them. And this is what I'm taking. And I just confirm that. I can add them, subtract them. It's really easy. Type the name in, the quantity, the dose. It's a very, very user-friendly website. They've expanded this so that now you can add up to 5 pharmacies instead of 3. By the way, you're not limited to these when you actually are using the plan. It's just for pricing purposes. You pick the pharmacies, makes it easy to even pick the pharmacies, and then it starts giving you information. So you click on go, and basically, it says there are 33 prescription drug plans available in my zip code. The one that you're seeing here is the plan that I'm in now. And they're raising the premium because my premium this year is, I think, $14.50 a month. So if I stay with this plan, this WellCare Wellness RX, they're going to raise the premium. But more importantly, what we're suggesting that you do is you can see down here, you want to sort by the lowest drug and premium cost. Now, a couple of considerations here. There's a new benefit. I can't see it because of, let me see if I can find it on the top right of the screen. You see that little thing that says box that says insulin savings? That's a new Medicare benefit. It's called the Part D Senior Savings Model. And if you're insulin dependent, if you click that box, it will show you only drug plans that have a savings on insulin, which means that your maximum cost for insulin would be $35 a month. Fortunately, I'm not taking insulin, so I didn't check that box. But when you do the sort, we suggest that you sort by the lowest total of premium plus drug cost. And this is my plan for next year if I don't change. And then I just picked 3 plans. The one on the left is my current plan, and the next 2, I guess I picked the next 2 lowest price. But as you can see, if I, just to pick an example, if I use mail order pharmacy, which is the cheapest way of getting my medication through my current plan, it would cost me $491.48. That's assuming nothing changes with my prescriptions. If I go to a different plan, Clear Spring Health, whatever it is, I could save $80. Now, that's not a huge amount of money, and but sometimes it is a huge amount of money. in any event, I'd rather have the $80 and go out to dinner if I ever can again myself than have the insurance company have it. And sometimes the savings are substantial. I saved my 94-year-old mother $800 last year by switching her Part D drug plan. And I saved a client $2,000 last year by, counseling him, and he switched his Medicare Part D drug plan. People just don't bother. So it's worth it. Do it. Look at it. To choose a Medicare Advantage plan, the tool is the same. Instead of clicking on the box that just says drug plan, you click on the box that says Medicare Advantage plan. And, I did that here. There are 38 Medicare Advantage plans this is Philadelphia, because that's my zip code, that include drug coverage. And you can sort them in a variety of ways. If you want to look at the certain benefits, vision, transportation, fitness, we don't recommend sorting that way, by the way, because there are restrictions on those benefits. We don't think that's the most important thing. If you want to be in a PPO versus an HMO, if you have a preference for, an insurance carrier, you can pick that here. And this is the summary card, they call it, that you would get that shows you the summary level information, the extra benefits you can see on the right. This includes everything on that list besides transportation is not included. It shows you the monthly premium of this one is $0. There's no deductible for either healthcare or drugs. This is a PPO. So if I stay in network, the maximum that I would pay in 2021 is $7,550. If I go in and out of network, there's a higher maximum of $11,300. By the way, for those in Philadelphia, we're preparing a summary of all of these because there's a lot of information here. If you click on plan details, you get much more information. You'll find out the co-payments for an X-ray, an MRI, laboratory tests, all the extra benefits. So it's worth taking a look at all the details, and then you can compare plans that you might be interested in. It's an excellent tool, and those of you who are computer savvy, I really believe you could do it on your own. But again, we're happy to help. You see the primary care copayment, the specialty copayment. Be cautious, this is a PPO, so if you go out of network, it's probably higher. But our summary has that. The biggest caution is do your homework. Question really is, do your doctors participate, hospitals, in this plan? And although the plans have directories and they're supposed to be up to date, I don't trust them. I always think it's worth making a phone call. You don't have to talk to your doctor. The doctor might not even know, but their office staff would know. And just as an example, when I was playing around a couple of years ago, trying to learn how to do this, I saw the name of a primary care doctor. I worked at Jeff. He's a good friend of mine. And I called him. I said, Howard, I didn't think you were seeing patients. He said, I haven't seen any patients in 10 years. But nevertheless, he was listed as a primary care physician. I don't remember for which insurance company. And he also got really good reviews, which was nice. So we always recommend do your homework, make the phone calls before you pick a Medicare Advantage plan. Now, if you already have Medicare, you don't have to sign up any again. If you don't have one, create a My Medicare account, and we strongly recommend that you review your health and/or your Medicare Advantage and prescription drug coverage each year. Why? I'm not saying you have to change it, but you definitely should review it. And, not only just my personal experience, but the Kaiser Family Foundation did some research last year, and they're saying millions of, this is just drug pan people, face increases in premiums and other costs if they don't switch plans. And 2/3 of 9 million people paid higher monthly premiums because they didn't bother to switch their plans. And don't you think that the insurers know that people don't look? That's why I ended up this year switching to a new plan with the same company, because they just raised the premium for my old plan because they think, gee, most people won't look. So please, 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 if you get one message from this, take the time to look at your Part D drug plan during Medicare Annual Open Enrollment, or your Medicare Advantage plan if that's what you have. So before I wrap up, I just want to summarize a few changes for 2021. We talked about the Part D savings model for insulin. If you have end-stage renal disease, you can now join the Medicare Advantage plan. You couldn't before. There's a new Part B benefit for acupuncture just for back pain, and it's very limited. And of course, given COVID, there's increased coverage for telehealth and other virtual kinds of visits in 2021. So the key dates, October 15th to December 7th, but you can start right now because the new information is up. You can be ready to go. January 1st, the new coverage begins. And then you can also, there's one chance if you make a mistake to switch back between January 1st and March 31st. So if something happens and you switched and you decide you don't like it, you can switch plans one time between January and 31st, January 1 and March 31st of 2021. So I am assuming that most of you, if you can afford to pay the premiums for Friends Life Care, are not very low income. There are programs to help with this. There are Medicare savings programs, something called a low income subsidy or extra help that helps with the Part D premiums. There's a state program called PACE and PACENet. All of these programs have income requirements, and we can help you apply, or if you know people who need help paying for their health care, please, please, please contact APPRISE and we can try to help them get into the right program. Since I used to be an academic, there has to be a final exam, just kidding, but we talked about the basics, parts A, B, C, and D. I think you know what they are now. We talked about the cost of Medicare. We talked about the coverage choices, the two paths, and you have to pick one. You can't pick both, one or the other, and that's a very important choice that you're going to make when you start up for start Medicare. And if you're still confused, we can help at APPRISE. And as Gail said at the beginning, it's actually a national program called the State Health Insurance Assistance Programs, or SHEP. Somebody in Pennsylvania decided to call the Pennsylvania program APPRISE. APPRISE actually is not an acronym, but just a made-up word. But that APPRISE is Pennsylvania's SHEP. It's mostly volunteers. We don't get paid for counseling. We agree not to take any remuneration. In fact, my neighbor, who I saved $2,000, wanted to take me out to dinner. And I said, I can't. I'll be happy to go out to dinner with you, but I'm not going to let you pay for it. And we also are, have signed the guarantee of privacy and confidentiality, because obviously sometimes we will get confidential information from people about their medication, etc. To contact APPRISE, Philadelphia is the only city that's split. I volunteer out of CARI, the Center for Advocacy for the Rights and Interests of the Elderly. Here's the phone number for CARI. If you live in North Philly, Northeast Philly, Einstein has an APPRISE center. And there's an APPRISE office in every county in the state, in the Commonwealth of Pennsylvania. If you call that 800 number, you can get the appropriate number for, I know some of you live in Montgomery or Chester, you can get the appropriate number to call. I'm going to put this back up in a second, but I just want to make a pitch. A lot of times we get new volunteers because of people that we've counseled. That's how I ended up here. I was counseled by somebody and then ended up being a volunteer. If anybody is interested in this, it takes a fair amount of training, but they're doing that virtually now. And frankly, I found it to be very, very, very rewarding, helping people with an incredibly complex system. I mean, I can't change our healthcare system, but I can help people navigate the morass of Medicare. So if you're interested, Gail can put you in touch with me, and I can, get you in touch with the right people. But I'm going to put this slide back up with the phone numbers, and then we still have some time for any other questions.
Okay, well, you just have just a few here, actually just one. Somebody wants to know, how do you find out how much Part B goes up based on age?
I'm sorry, Part B doesn't go up based on age. Part B goes up each year based on a calculation that the Congress makes. So the Part B premium doesn't go up with your age. Your Medigap premium goes up with your age.
Okay, thank you.
The Part B premium goes up with your income, not with your age. It's different because of that IRMA, but it doesn't go up with your age.
Okay. Thank you. Thank you. Thank you. And it looks like you did a great job. So that's really the last question that we have. So thank you so much, Jan. Really appreciate you being here with us. And you gave us lots of great information, lots to think about. You have the handout. We did 6 slides per handout. Hopefully you can read what's on the slides. If you need to look at them again, you'll get a copy of, you'll get a recording of the webinar. And within probably 4 hours, and you can kind of go back through it and you can see all the slides on there too. I just want to see, it looks like, okay, so, oh, I'm sorry, there's a clarification. That last question was they meant supplemental Medigap. How much does it go up with age?
Okay. Yes, if they meant Medigap, it does go up with age, but that's different for every insurance company. And that's the information that we can provide to a client by looking at the Medigap market research tool that we have access to. The plan, if you try calling the plans, you're not gonna get that information. But it's different for each insurer. And although I caution you that the forecast is not a guarantee, as they say with investments, past performance is not a guarantee. But we can give you a pretty good idea of how much it's going to go up, but it's different for each company. So your choice of a Medigap plan should be based on a G plan, the letter plan that you want. It should be based on the premium that they start with, but also on your estimate with whatever information we can provide of how much that's going to go up each year. I mean, one of the dilemmas that people face, and are still facing, is United Healthcare almost always charges more for their Medigap plans in the first year. In fact, I shouldn't say almost always. In every situation in Philadelphia, they charge more initially. but their argument is it doesn't go up as much. So, you're faced with trying to look in a crystal ball. I can't answer whether how many years it's going to take to catch up, but we can give you some information about price increases that every one of the insurers have experienced in the past and forecast for the future. So we can tell you that, and then you can, try and use that to make a choice. But I strongly recommend you won't get it on your own. Call your local APPRISE office.
Thank you, Dan. APPRISE is a wonderful service. And for people that live out of state, they would just go look up SHIP for their state, look up Google their state?
Yeah, good question, Gail. This is a national program. It's all over the country. It's actually, if have gotten the Medicare and You for 2021, or your local one, the state you live in, the phone number for your state is printed in the Medicare and You book for 2021, or you can just Google it. I mean, I don't have the numbers for other states, but it won't be hard to find. If you look SHIP for New Jersey or Connecticut, you'll find it.
Well, it's just nice to know that it's there, because this is very confusing and there are a lot of decisions to make. So it's wonderful to have people like you and APPRISE that help people make these decisions and kind of wade through all the different options. So Dan, thank you so much. That was an absolutely wonderful presentation. Really, really appreciate you being with us today. And just ask that everyone, when you leave today's webinar, you're going to receive a quick 5-question survey. I mean, really quick survey. And we'd really appreciate it if you could give us your feedback, because that'll help us improve in the future and let us know what you're looking for in the Bigger Wellness webinars.